And so next we have Alastair Tallis from University Hospitals Coventry in Warwickshire, using a network approach to address the everlasting problem of specialist nursing recruitment in the setting of transplantation. Thank you, Alastair.
Thank you. So good afternoon all, and welcome to the Midlands Kidney Network presentation on how a network approach has been used to address the never-ending problem of specialist nursing recruitment. So as Rosie said, my name is Alastair Tallis and I'm the project manager for the Midlands Kidney Network. So just before we kick off, I just wanted to say that this approach has been in collaboration with Marie Atkins, who's the network manager, Dr. Kerry Tomlinson, who heads up and chairs the transplantation work stream within the Midlands Kidney Network, NHSE project proposal teams, and multiple colleagues within multiple NHS trusts throughout the Midlands. So thank you to all of those who have been involved. So we know through experience and research that there is gaps and large gaps across both transplant and non-transplanting centres when it comes to accessing preemptive or early transplant listing and living donor transplantation. So just a brief overview, this is widely acknowledged in many different publications, such as the annual reports from NHSBT and the UK Renal Registry, along with GIRFT, and furthermore the NHSBT 2030 strategy, which prioritises an increased utilisation of transplants, and the Health and Care Bill prioritises health, value and equity. So furthermore, in GIRFT, the GIRFT Renal Report of 2021, recommendation 4 is to streamline renal transplant pathways to increase access and reduce unwarranted variation in decreased and living donor transplantation. So the recommendation 4C suggests that renal centres should have a dedicated nurse specialist transplant workforce. Further evidence, we've got further compelling evidence from the ATOM study in 2016 and QI projects such as CakeWhip's Transplant First tool, which shows that local specialist nurses are vital to ensure that patients are given access to early transplant listing and access to living donor transplantation. I just think this is a really critical box plot graph. It just shows the difference in staffing levels. On the right hand side, you've got units where there is above medium national staffing levels, and then on the left hand side where there is below national staffing levels, and you can just see the difference in the rate of transplantation in living donors. So we're talking roughly a 20% difference. So it's just to highlight the importance of a well-resourced workforce and the impact that that can have on living donation. So what did the Midlands Kidney Network do with all this evidence? So in 2021, we got the opportunity, like you all, to apply for funding from a network point of view. And Kerry and Marie kindly completed the proposal, which we're happy to share with other networks should they like the full details. So it demonstrated to NHS England the opportunities, gaps in service with the overall aim to improve patient access to early transplantation. As we all know, an essential part of justifying proposals is around the cost and the savings. So I won't read through each individual one, but just to show that the statistics speak for themselves, and there is absolutely massive savings when considering transplantation staff over dialysis and the estimated patient numbers as well. So the proposal was submitted and it was a fairly apprehensive time. But thankfully it was agreed. So what did we do next? So the funding was agreed for 4.5 whole-time equivalent nurses. So the next step, me and Marie and Kerry got in touch with all the non-transplanting centres within the Midlands, requesting their expressions of interest in securing this funding. So there's a few caveats to the funding, which we needed to make sure that the trust could provide reasonable timescales in recruiting staff, and also have the capacity to support additional workforce as well. And also the network, we went further, not just going out for the expression of interest, but we also developed job descriptions, person specifications and job plans to reduce the burden on NHS trusts who were expressing their interest. So basically they could just go out to advert really. So these are the trusts that express their interest. So we've got Dudley, Wolverhampton, Shrewsbury and Telford, Northampton, Derby and Burton, and the University Hospitals of Birmingham. So I know what you're probably all thinking. Well, Birmingham has a transplant centre. It's not got a non-transplanting centre, but its sister hospital, Heartlands, is considered as a non-transplanting centre. So there we go. So some of the issues that we had with recruitment were the job specifications, the job descriptions meeting all the trust requirements. Some of the issues we had was just making sure that the money was smoothly transferred to from NHS or to each of the different trusts. Some of the issues were around getting the job out to advert, and also due to limited applications, there needed to be a number of re-advertising in several units due to limitations in there. But thankfully, from November last year to June this year, all 6 nurses are now in post. So here they are. It's not all of them. So there's Michelle in the middle from Heartlands. We've got Ellen on the bottom left from Derby and Burton, Benita at the bottom centre from Wolverhampton, and then on the right-hand side, we've got Priscilla from Northampton and Gloria from Dudley. So there's just Leanne at Shrewsbury that we need a picture of. So I'm going to be talking to Rob to see if we can get a photo of Leanne for us. So what did we do next? So supporting the support that was offered from the network, we have over 12 educational webinars that we've recorded since the summer from a variety of experts within the transplantation field. So they're recorded and available, and they're accessible on our NHS Futures page. So anybody can have access as long as they've got access to our page. We've been bringing the nurses together virtually. Also encouraging the nurses to engage with their local transplant centre to make sure that they can view the patient journey from not just where they are, but through the transplant centre as well. And also they've been involved in the Living Donor Quality Improvement Project, which has been led by KQIP. So obviously this is going to be quite an important part of the project as we move forward. So how can we review the impact and benefits of the 6 nurses in post? So we're currently waiting for impact documentation from NHS England. So we're hopefully going to be completing that over the next 1 to 2 years. We're also running a Midlands-wide transplant prem, and obviously the Transplant First tool will also help to show the benefits, and then questionnaires out to the clinical leads and nursing leads about whether the posters increase the department focus on living donation and preemptive transplant, which I know that they all have. So, and that's it from me. So I will leave any questions to the end. Thank you.
Thanks so much, Alastair. Really great to see how the network can be working together so effectively so that it's not just one hospital that benefits, but hopefully all of them. Inspiration for us all there in our networks. So do put any questions you have for Alastair or anyone else in the chat. So we've just got one more talk before the coffee break, which